Welcome to today's Way Forward Workshop Leader Lunch Break, where we are pleased to welcome Dr. Lisa Ramirez, psychologist, professor, author, award winner, but I think the best descriptor for Dr. Ramirez is caring listener. She joined MetroHealth 11 years ago, and she now wears multiple hats there. She serves as clinical psychologist, associate director of pediatric psychology, and as director of community and behavioral health in their school health program. She's also an associate professor of psychiatry at Case Western Reserve University School of Medicine. With a focus on child and adolescent behavioral health, Dr. Ramirez specializes in trauma and toxic stress. Her world is reaching out to our children and our young people suffering from anxiety, depression, and behavioral challenges. Her work extends to their families, for she knows all too well that meaningful and healthy relationships contribute significantly to our well-being. Our social connectors are a strong indicator of good health. What she loves most about her work is that her practice takes her into the community. Her world is not limited to her desk, and she can be seen in Cleveland schools, pediatricians' offices, basically wherever children are found. She promotes safe, where students are free to express through the arts and can practice healthy coping and building resilience. Despite the fact that her work is all-consuming, she gives back to the community through service on the boards of Conservancy for Cuyahoga Valley National Park, the Positive Education Program, and the board for the MetroHealth Foundation. Dr. Ramirez, thank you for joining us today. We look forward to the conversation.
Wow, well, thank you for that. Rachel did say that you come up with your own introduction, and that was wonderful. Thank you for highlighting some of my favorite things. I appreciate that. So thank you for inviting me today, Marianne and Rachel, to be a part. And thank you for those of you who are here with us with the Cleveland Leadership Center to listen to me for a little bit, talk about some of my favorite things. So I am going to share a little bit of information, but before I do that, I just wanted to level set a little bit about MetroHealth, for those of you who may not be familiar with our system. So MetroHealth is the county's safety net health system. We are what we like to refer to as an essential public health leader, and we've been serving the greater Cleveland area in some shape or form capacity since 1837. And our mission is really dedicated to hope, health, and humanity. And I love that hope is listed first, and I'll tell you why in just a little bit. When I think about my purpose and our purpose as a system, I really see it as elevating the community's health by addressing often overlooked factors that can either impede or, now more importantly, promote our well-being. So what I'm going to do a little bit today is talk about like social determinants of health, social drivers, and why they're so important, and then a little bit about what we're doing, and hopefully open it to some questions from the audience and see what's going on. So I'm going to go ahead and share my screen just for a little bit here. Rachel, I can see you. Will you just thumbs up if it looks okay? Okay, great. So you may have heard, and I looked a little bit at who might be here today. So I think for a lot of you, this may be a review, but social determinants of health have been around now, I would say, in conversations related to health systems for about 5 to 6 years now. They've been around a lot longer, obviously, but we're really starting to appreciate the impact of them. And also, the terminology is moving towards social drivers of health, and I'll tell you why I think that's actually a really nice movement. So the easiest way to think about these social drivers is the combination of factors that lead to how healthy we are. So if you look down at the bottom at the health outcomes, when we think about health outcomes, we're thinking about how long we live, the diseases we do or do not develop, functional limitations refer to, are we healthy enough to be able to get to a job and be able to do the jobs or sit in the classroom, things like that. And so those health outcomes we're starting to understand really are the result of a combination of these pillars. And so, we think about these pillars, things like economic stability. So looking at employment and if we have enough of an income to cover, our daily expenses, neighborhood and physical environment. So do we have safe housing, transportation? Are our neighborhoods safe for us? Do we have access to parks and playgrounds and walkability? Education is a massive driver, right? So thinking about, especially early childhood, are we giving our children a good foundation to be able to engage and be present in the learning environment? And then beyond that, higher education, vocational training to be able to go back to that economic stability around living wages. food? Do we have access to quality food? Do we have access to healthy options? And then community and social context, things like social integration, and integration is a word I'll come back to later. Support systems in and around our communities where we work, community engagement, and a sense of discrimination, if we feel integrated or marginalized in our communities and where we live. And then that last pillar is what we typically think of, our clinical care and our healthcare. So do we have access? Are there enough providers for us? Is it in a way that's competent and the quality? But the surprising part is that actually, when we look at the proportion of what drives our health, really only 10% of it is due to our genetics and that clinical care, so what we do within our proverbial four walls, but the other 80% is attributed to those factors that we talked about, 80%, right? And so I think that's huge. And I just want to pause there for a second for those of you that weren't familiar with that, we understand that health is important. And for a long time, we focused on that clinical aspect. And now we're really starting to understand that it's what happens outside that impacts so importantly. So one example of a social driver that I've talked about often, especially, Marianne mentioned that I really am interested in child development and trauma, toxic stress, is something called the adverse childhood experiences. I'm not going to spend a whole lot of time on this because I don't have a lot of time to talk today, and I could talk about this for hours. But the premise behind ACEs, as they're known, adverse childhood experiences, is that about 30 years ago, a pair of researchers identified these 10 adversities that could happen before a child's 18th birthday. And if a person has 3 or more of these adversities, if they experience 3 or more of these before their 18th birthday, they're anywhere from 2 to hundreds of times more likely to be at risk of poor adult health outcomes. And those are things like increased risk for obesity, some of what we call like the health behaviors like smoking or drinking, but even things all the way to strokes, cancer, and lung disease. And so we're starting to understand, again, that it's the experience in your environment that can really drive those, even in childhood, those adult health outcomes. And while ACEs is a really important framework, they only were part of the story, and that's part of the story. I want to talk real quickly, put a bookmark and like the pin in the difference between something called risk and something called protection, right? So a lot of where I've been in the last 10, 15 years over my career is thinking about risk factors and adversity. And those, I look at risk factors almost like a rung on a ladder leading up to some of these negative health outcomes that we think about, like I mentioned, obesity, cancer, lung disease. Risk takes you higher up on that ladder, and protection and protective factors help move you back down. So I think it's important that we do understand the risk factors and where we are with risk, but I'll talk about why moving into thinking about protection is important. So staying on some of these risk factors, I do like to highlight that, when we think about in clinical care, we often think about patients, but as our CEO at MetroHealth, Dr. Steve, likes to say, is our communities are our patients as well. And so just like we would take vitals of a patient, we're going to take vitals of our community. And if you look here, states around the country rate and rank their counties based on some of these health outcomes and health factors. And so something that always sticks out to me is that, if you look at 2022 and 2023 there, and, this is a lot to present here, but we are getting better in most measures except overall health outcomes. But if you look at social and economic factors, where we're ranked 80th out of 88 counties, and physical environment, where we're ranked 79th, and actually in 2020, we were 87th. So we've made a lot of progress, but we're still near the bottom. And just social and environmental factors and physical environment together account for 50% of what influences our health. So we've got a lot of room to improve, but I see that as hopeful. We've got a lot of opportunity to make an impact, right? So, with the drivers, and the reason I think that's an interesting word that we've shifted to, or I like that shift, is that we get to hopefully change the steering in the direction of where those drivers are pointed, right? So, I think we can start to, if we think about working together and integration, and that's where I live, that's where then, we can start to make an impact. So I'll bring up the slides in just a second, but I kind of, meant to be more conversational. And so, I think MetroHealth and what I've seen, so I've been faculty at Metro now for going on 11 years, but I've really been at Metro as a trainee and a student, in my career for 17. And so I've seen over those last 17 years that we've really built upon and intentionally started to lean into these social drivers and really think about protection, especially in our most vulnerable neighbors. And so one of the main ways that I get to do that and work toward protecting populations is collaborating and doing integration. And so whether that's integration into primary care clinics, into education systems, herein lies the foundation of where, we really start to move the needle. And so one of the programs that I'm involved in that Marianne mentioned is the school health program. And so that's an example where we are integrating. So we're bringing healthcare and clinical care into or onto the grounds of schools so that we are helping to mend together and integrate the health system, the family systems, the education system, so that we can help keep children healthy to be able to be in school and what we call seat time, increase the seat time, so that, there's all of those systems are working together to start to address those pillars. And education is a very important social driver. So we actually have an entire institute at MetroHealth called the Institute for Hope. I for Hope, you may see it written out, that's dedicated specifically to social drivers and has a variety of programs like school health that focus on really moving beyond those four walls and bringing clinical and medical care into our communities. And so we think about like diagnosing and treating our communities by going beyond traditional medicine and building upon and nurturing those relationships. So I'm actually now going to share one more time and then wrap up here. So this shows here, hopefully, the pillars of those I for Hope. So HOPE stands for the health. So we're really thinking about trying to lead efforts to address those barriers, thinking about opportunities to really impact practice and learning and policy, partnerships with which many of us will say is the most important of those four, and really thinking about how we impact individuals and neighborhoods and communities through those collaborations and partnerships and integrating systems. And of course, E is really co-creating and self-sustaining communities where everyone is empowered through the education, through the partnership to live their possible healthiest lives. And so one of my favorite slides to show is actually this one. So this comes from the Center on Developing Child, and I use it a lot when I'm talking about prevention, early identification, really thinking about where I live, which is of course, up to about 25 years old. And when we think about development, that prevention sometimes doesn't get enough attention in my mind, because with a little bit of effort, we can have a huge impact. But I think there's that, this generalizes decently into thinking about our communities as well. And so if we only focus on things when they're a problem, or only focus on the diseases and really don't think about how we can move a little bit earlier, into those relationships and collaborations and how we can empower each other to have an impact, we're missing massive opportunities to have a lot of impact and prevent or help to move our county up in those health rankings, instead of allowing them to stay at a place where they're impacting our children's health and our health in a massive way. And so, each of us has an opportunity to impact, whether it's on a personal level or on a professional level, organizational level, these social drivers. And one example that I want to give you is meaningful relationships. And so as Marianne mentioned, when I think about risk and I think about protection, meaningful relationships across most research and for decades are protective. One of the most powerful protective factors is meaningful relationships and social connection. And MetroHealth was one of the first health systems in the country to start screening for social drivers, and now we screen all of our patients. And as of February of this year, of 24, we've screened almost, and I'm sure by this point we've surpassed 141,000 patients. And the risk part of that is that one of the highest, I guess, where we hit one of the highest points is social isolation. 92% of our patients screen either in danger or at risk of social isolation. And this is a huge area where we can start to make an impact, because we know that it's really important. And social connection can be on an individual level. So checking on each other, on your employees, on your colleagues, on your families, on your neighbors, and also thinking about systems being meaningful relationships as well. And so when we have a connection, we make those connections first, we have common goals, and most importantly, that all participants in those relationships feel valued and supported, then you'd be surprised. And I think the possibilities are endless. And that's where I get to live every day. So I love what I do, because I get to live in that hope of what's the next opportunity to be able to impact and continue to elevate the health of our communities. So I am at 12:15. I was timing myself. So I'm going to go ahead and stop there. And I think at this point, we open it up for questions.
Yeah, great. Dr. Ramirez, thank you so much. So let's start with kind of when you're working with patients in your practice, when you start to recognize that there are social drivers of health at play impacting an individual's health, how do you bring that into the conversation? How do you work with that patient to start to identify where those issues may be?
Yeah. Well, I think it's important, and we practice this a lot. So I think sometimes even health systems or organizations think, well, we can just bring two systems together, or just kind of, I say plop, right? Plop the visual, of collaboration. But there's actually a little bit of an art to that, and thinking about communication around that and values in that. And I think it's really important as we start to have conversations with partners and with families and community as well, that we are not saying that the risk is a sentence, right? We're not saying, okay, because you have an A score of 7, there's no hope, right? It's all about understanding, empowering, and providing the education. So we ask these questions for a reason. The reason we're asking this is because we understand that either we can help make a change, we can prevent things, or we understand there are opportunities, whatever it might mean. And then we make the connection and the warm handoffs, as we call them. We have some fantastic partnerships with our community health workers who, specifically look at social drivers, who can make those handoffs and have, I for Hope has these fancy systems that I'm less familiar with, that how to do those handoffs. But a lot of it, and I also come from a trauma-informed lens, I do a lot in trauma-informed world, is transparency and empowerment and voice and choice. And so you can have most conversations if you're coming at it from a perspective of mutuality, collaboration, and we're providing this information because we can try and help, we can try and redirect where this could end up. And that's the same for me in mental health. I mean, those conversations are really hard to have with, families, and so social drivers really weave into that. And because we integrate behavioral health into our primary care, and we have social work and community health work, it has started to become really seamless, and I think our families experience that well. But it does take practice, because sometimes the messaging can you just have to be sometimes a little bit conscious and thoughtful about the messaging.
And can you talk a little bit more about what does it look like to integrate kind of more of a holistic healthcare approach, especially when you bring in behavioral health?
Sure. So if we're thinking about behavioral health integration, so with integrated care, and it's a little confusing because integrated care is often the umbrella term, and then under integrated care, there's collaborative care, there's co-located care, and then there's full integration. So collaborative care is, communicating back and forth. And I often think about integration or collaboration almost like spokes, and that they turn in the time with which the systems can communicate. And so collaborative care, when there's communication, whether through an electronic health record or, phone call, whatever it might be, it's just a little bit slower, but integration sometimes can be a heavy lift. You need a lot of bodies to be able to do that. Co-located care or co-location is where we have multiple systems or specialists in the same area. And actually, I for Hope have some places, some physical locations where you might bring in, multiples like WIC and, different opportunities to have touches that are co-located. So they may not share information, which can be sometimes important for families. We don't necessarily need all the systems to know what we're doing, but if we can do a one-stop shop and have access, that's really the beauty of co-location. And then full integration is where there's that whole perspective, whole person and whole child perspective, that whatever the need is, there's no wrong door. You come into the clinic and whatever it is that's identified, we have the ability to address it. And also we're asking everybody these questions. We're not asking you because you look a certain way or because, you're dressed a certain way or you say a certain thing. We're really making sure that nobody's flying under the radar, and we're trying to screen for all of that. And then again, the availability and the real time is really important, because sometimes you make a referral and it's either really hard on the person to navigate other systems, or there are competing priorities, or it doesn't feel as important when they leave. And so to be able to have individuals in the same place at the same time to hand off to, then those connections, those meaningful connections can happen in real time.
We had a question around the foster care clinic that Metro has been running. What kind of updates might you have about that particular clinic, the services provided, and the outcomes, and what support might be needed?
Absolutely. And I can, I'll answer it sort of briefly. I have a colleague who may or may not be on the phone, but and anybody's welcome to reach out to me. welcome to come grab a cup of coffee with me at Metro. I could talk about social drivers and all day long, and happy to. But with our foster care program, so we are the medical home for children in foster care in Cuyahoga County. And what that means is that any child that comes into county custody gets an immediate physical exam, but it's also integrated care. So not only are they getting the screener for the physical, we're also looking at the social drivers, we're looking at mental health, and it's part of a medical home. And so it's like I mentioned that last with the integration piece, everybody is present, social work, whatever that child and or the foster family may need, we're able to access it in real time. And we work very closely with county because sometimes, again, thinking about the integration of systems, the county system, education system, health system, sometimes it's hard to get releases of information or understand who, how to communicate with different people. And in this way, it is really truly meant to be a place where it is that one-stop shop for a very vulnerable, population going through a significant change, And so we, this year have expanded to include a little bit more of the behavioral health side, and we're constantly looking to see how we can improve that, but happy to talk more about it and connect you with my colleague, Dr. Murray, if you're interested.
I'm here, Lisa, and actually, another part of the question was what support does the program need from the community? And we need everyone on this call to sign up to be a foster parent. That's what we need from the community.
Thank you, Dr. Murray. Thank you.
So let's go back to talking a little bit about ACEs. So as a child experiences more ACEs, so say 3 or more, how does that begin to physically affect their development?
Yeah, that's a great question. And so that's a little bit more of a complicated explanation. So we know, because the research has borne out over the 30 years, that that construct holds up. And what we mean by that is when the research is done, we see the same results. What we're starting to understand now is that there's a level, something called toxic stress that can play out. And so the reason that it's called toxic stress is that stress in and of itself is meant to be evolutionary adaptive, right? We see a bear coming at us, we get a huge rush of cortisol that goes through our entire body because we have to survive. We have to run away from the bear, our hearing needs to be sharper, our heart needs to pump faster, all of those things, right? And so the problem is that when we have huge doses of stress and cortisol that lasts over months and years, that touches every single organ system in our body and can break the blood-brain barrier between cortisol, epinephrine, norepinephrine. And so over time, those systems, because of it's a steroid that's running through our body, over time, that's where we're starting to understand that that's the mechanism by which adversity in childhood, especially in doses where we're not meant to tolerate, starts to have that long-term where the organ systems are working harder and longer and not, like diabetes or pancreas, right? Or heart. It's very interesting that, there's essentially a hydraulic system where your body understands how much blood to push out, when to, bring it back. And over time, when it's constantly pushing out, the walls get thicker, right? And your blood pressure raises. So each and every organ system in the body has a mechanism like that behind prolonged stress and trauma. And so we're starting to truly understand that, our body is a fantastic, well-oiled machine, so to speak, but it's not meant to tolerate stress for that long and in those large doses. And that's why it's called toxic. But one of the protective factors within toxic stress is meaningful relationships.
So many employers are looking at how they can support the well-being of their employees. So what are some best practices that employers can employ to help with addressing social drivers of health in their workspaces?
Well, actually, it's interesting because Metro recently started screening our own employees for social drivers. So we have a separate screening for, our patients and then for our employees, because we want to understand, right? We're asking our employees to show up whole to be able to care for our vulnerable populations, but our employees showing up whole, and so I think there are definitely ways to do that. One thing I will say, and this is what we say about ACEs, and this is why I was saying it's only part of the story for that framework, is you want to be able to have a response for what it is that you're asking and make sure that you're not only looking at the vulnerability, but also those protective factors, right? So if, let's say, school systems used to ask all the time, let's screen for ACEs, our parents, our teachers, our students, right? Let's know ACEs. But ACEs is only part of that, because you have to understand, if you have 2 students who come in with an ACE score of 5, but one of them has meaningful relationships in the home, and they have access to great food, and they're part of the, extracurricular activities, and they've got all these protective factors, that ACE score of 5 may have a minuscule impact. It won't only take them up a rung, if any. But you have a different student with an ACE score of 5 that doesn't have those protective factors, then you really need to think about helping to promote the protective factors. So I think screening for risk can be important, but you need to have a response to that. If you move towards something like that slide I showed with thinking about prevention, how are you raising everybody up by thinking about promoting protection in general, social interaction, ways for your employees to, have social connections with each other, checking in with each other, and thinking about those pieces. And so there's just different ways to think about it. We screen because we have the capacity and the need to be able to intervene for risk. But I think there's a lot of benefit to really thinking about promoting wellness as well, and whole person wellness, thinking about those social drivers, right? So sometimes there's jokes about that's not just a pizza party. I think all gestures are great, right? But truly meaningful promotion of wellness and those protective factors like sleep, nutrition, mindfulness, right? Which could be engagement in the arts. It could be actual meditation. Mindfulness is massive because it takes you out from the limbic system, which is where the stress happens, to the front part of the brain. They don't operate at the same time, but this is where creativity and art, and all of that lives, and planning. So different ways to think about it. But I would encourage promotion of true kind of whole person wellness. And then you can think about whether or not screening is something that would be meaningful for your system organization.
So how is the referral network for social needs founded by Metro going? Are patients getting the referrals that they need to address some of their concerns?
So that's a great question. And I will say I am less familiar because that's not that's community health work. That is a different arm of I for Hope. I am happy to follow up if, but my understanding is that there are different systems that we use, including something like Unite Us, Unite Ohio, that we use. And I believe that it allows us to make the referrals and understand when those referral loops are closed. I believe it works well, but I couldn't give much more detail than that other than we use it pretty regularly.
So do you feel like we as a community here in Cleveland are making progress in supporting our young people to live healthy lives?
Oh, we absolutely are making progress. I think, even small steps of progress are important. And I think, I always think back to progress doesn't always look like a curve, where if you look at it, everything is positive. Sometimes it's stair steps and sometimes there's a little bit of dip, but if over time, thinking about positive, I think there are lots of ways in which we are really understanding, preschool and thinking about maternal mental health, thinking about, really focusing like our CEO right now in our system is really focused on equity, and especially thinking about, making sure that Black women, especially Black moms, are supported, because the mental health of caregivers and parents right now we're realizing is really important. So there are a lot of ways which I think we are doing a great job. Places where we're not doing a great job, I think, is like the increase in gun violence. And so there's more attention being paid to why is that happening. And so Cleveland has some really incredible grassroots organizations. They have some incredible, I think, health systems and everything in between. Those who know me have heard me say this before. I think where we probably need to stay for a little bit is really thinking about the gap between the intention of what it is that we think we're doing and the actual implementation. And I think it was Maisha Watkins that talked about having community partners at the table and making sure we're listening. And I don't know that we always do enough of that. We have these grand ideas, but then in practice, they don't always pan out the way we think they are, because we don't have that complete integration in all the systems possible. So making some great progress. And I think if we take a look back, we can definitely see some positive trend. And our county data is showing the same. I think there's a lot of room for improvement. And the more we start to make those meaningful connections, more collaboration, and think about impact, we only have up to go.
Well, I think that is a great note to wrap up on. And so, Dr. Ramirez, we thank you for your time today and sharing your expertise and your passion, and for all the work that you and your team at Metro are doing to help address the social drivers of health here in Cleveland.